Hello, my name's Judy Kite. I'm a Strategic Health Facilitator and Acute Liaison Nurse. Over the past few years, the government have published a number of reports showing that people with learning disabilities face health inequalities. These reports include Treat Me Right by MenCap, Equal Treatment Closing the Gap by the Disability Rights Commission, Death by Indifference, another tragic report by MenCap, and Sir Michael's inquiry, Healthcare for All. All of these reports highlight the fact that on the whole, people with learning disabilities get poorer treatment than others. These investigations show that people with a learning disability receive fewer screening tests and fewer health investigations, that people with a learning disability are less likely to get the health care they need, and they are more likely to have heart problems, have breathing problems, be overweight and eat badly, have certain cancers, have dementia, have dental problems, die early, and are less likely to have a health check, be screened for cancer, be given pain relief, have had a sight test or a hearing test, be included in patient forums. Many of these things happen because of diagnostic overshadowing. Here are some real-life stories about people with learning disabilities who have died. Emma. The first case study is about Emma. Emma died of cancer at the age of 26. She had a severe learning disability. This meant that she sometimes exhibited challenging behaviour and had difficulty communicating how she felt. Emma's parents were told Emma had a 50-50 chance of survival, but the doctors decided not to treat her, saying that she would not cooperate with the treatment. Emma and her mum were sent home without any advice on how to manage and no way of dealing with Emma's pain. Tom. The second case study is about Tom. Tom was just 20 years old when he died. He had profound and multiple learning disabilities and died of aspiration pneumonia and reflux esophagitis. While he was still at school, his parents insisted that Tom was in pain and that he had been referred for medical investigation. Further investigations were not made, and he continued to lose weight and engage in unusual behaviour such as gouging his head. Tom's parents felt he was expressing pain through behaviours. Tom had an ulcerated esophagus but died before receiving nutrition as he was so weak. Martin. The third and final case study is about Martin, who died of stroke at the age of 43. He had a severe learning disability and no speech. In the 26 days that he spent in hospital before he died, he went without food. The hospital failed to use nasal feeding tube to prevent his condition from deteriorating. They left him feeling too weak to undergo surgery. The hospital admitted that they did not act on the information that Martin was assessed as being high risk in relation to a malnutrition assessment, and that they hadn't followed their own policy to try alternative methods of feeding after 7 days. So what is diagnostic overshadowing? This means when a person's presenting symptoms are put down to their learning disability rather than seeking another potentially treatable cause. For example, physical problems, pain or discomfort either from an ear infection, toothache, constipation, deterioration in vision and hearing, psychiatric causes such as depression, anxiety, psychosis, dementia, or social causes, changes in carers in the home environment, a bereavement, or a person suffering from abuse. Many years ago, I worked with a gentleman who exhibited very challenging behaviour. His behaviour began to escalate and he started to projectile vomit. He was admitted to an assessment and treatment unit. Many months later it was discovered that he was suffering from esophageal cancer and he died. If people had undertook physical examinations and investigations around the time rather than assuming that this was a behavioural and intentional behaviour, the outcome might have been very different. So always remember, just because a person has a learning disability, it doesn't mean that they do not have other health problems.